Hey guys, if you haven't heard about Anchor by Spotify, it's simply the easiest way to make a podcast. Anchor by Spotify has everything you need all in one place. So let me explain. Now, Anchor has tools that allow you to record and edit your podcast right from your own cell phone or your own computer. Now, I've been using and loving Anchor by Spotify for 2 years now. And don't forget that Anchor will go ahead and distribute your podcast on so many listening platforms like Spotify and Apple Podcasts, and so many, many more. Now, I think it's simply everything you need to make your own podcast, all in one place. And don't forget, Anchor is totally free. So why don't you go ahead and download the Anchor app or go to anchor.fm to get started. I can't wait to hear all of your podcasts. Hey everyone, welcome back to all my listeners. If it's your first time finding me, thanks so much and welcome. This is episode 10 of my 7th season. Today is Wednesday, November 9th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, I hope you all cast your vote yesterday on Election Day, either by mailing in your ballots or actually voting at your polling sites in person. Or maybe you had a chance to early vote like I did. Now, can you believe it's already November? Where did the month of October go? 31 days just blew by so quickly. So that means it's November. Those holidays are just around the corner. And I know I've already been seeing those Christmas lights up as of November 1st. I'm not too sure how I feel about that in the landscape next to a few ghosts that I still see hanging from trees. Now, I know I'm looking forward to celebrating Thanksgiving first because I get those pies, and you guys know me, I love lots and lots of pies, from pumpkin to cherry to pecan, all of them. They're all so tasty. Can't wait. Now, anyways, all right, you guys, let me start unpacking the day. I'm going to be diving into my compliance tips and my compliance recommendations today on the new CBR for Initial Nursing Facility Evaluation and Management Services. And of course, it is the second Wednesday of the month, so that means I'm going to be getting into the Newsworthy OIG Work Plan updates for October 2022. And I'm going to round out today's episode with the remarkable quote on purpose and impact by Bishop T.D. Jakes. If you checked me out on LinkedIn, you know I'm about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I am bringing you the news, current healthcare industry news, my compliance tips and my recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into Newsworthy. It's the second Wednesday of the month, so that means even in Season 7, I'm going to be going over the month's OIG Work Plan updates. Now, the first OIG Work Plan update for October 2022 is titled Mandatory Review of HHS Agency's Annual Accounting of National Drug Control Program Funds. Now, this report is coming from the Office of Audit Services. From the Office of National Drug Control Policy's circular, it states, the Drug Control Program Agency Compliance Reviews requires agencies expending funds on National Drug Control Program activities to submit an accounting of such funds made during the previous fiscal year. And this is stated in 21 U.S.C. Section 1704. The policy also requires that an agency submit with its annual accounting an authentication provided by the agency's OIG that expresses a conclusion on the reliability of the agency's assertions. The circular states that if in an agency's prior year drug-related obligations were less than $50 million, the agency would not be subject to these authentication requirements. The OIG will review how HHS agencies complied with this circular, and they will submit the authentication with respect to the HHS agency's annual accounting, beginning with fiscal year 2020, once every 3 years. This final report is expected in fiscal year 2023. The second OIG Work Plan update for October 2022 is titled CDC Oversight of the President's Emergency Plan for AIDS Relief Funds. This report is coming from the Office of Audit Services. The Centers for Disease Control and Prevention, the CDC, has been working to combat HIV since the start of the HIV epidemic. As an implementing agency of the President's Emergency Plan for AIDS Relief, also called PEPFAR, CDC works side by side with foreign agencies of health and other partners to improve methods for finding, treating, and preventing HIV. CDC has received more than $5.4 billion for fiscal year 2019 through fiscal year 2021 to accelerate HIV treatment and prevention worldwide by using public health, innovation, and data-driven approaches to achieve the global goal of HIV epidemic control. To date, HHS OIG has conducted 10 audits of CDC's PEPFAR oversight operations in 5 countries on 3 continents: Africa, Asia, and North America. OIG's PEPFAR oversight has helped the CDC and other HHS staff members learn important grant and program integrity lessons that apply to ongoing and future responses to infectious diseases. In previous audits of CDC offices in the U.S. and foreign countries, OIG identified noncompliance with policies, inadequate monitoring of recipients, and internal control weaknesses in the awarding of PEPFAR funds. OIG will determine whether the CDC performed these 2 things. Number 1, if the CDC effectively awarded, monitored, and accounted for PEPFAR funds in accordance with federal and departmental requirements and the Office of the U.S. Global AIDS Coordinator and Global Health Diplomacy guidance. And finally, second, if the CDC followed established processes for the reprogramming and/or the redirection of PEPFAR funds used for COVID-19. The audit of controls over reprogramming and/or redirection of PEPFAR funds for COVID-19 will be a collaborative audit conducted by HHS OIG and the U.S. Agency for International Development's OIG. Each OIG will issue a separate report. This final report is expected in fiscal year 2023. Now, the third OIG Work Plan update for October 2022 is titled Recipients' Use of President's Emergency Plan for AIDS Relief Funds. This report is coming from the Office of Audit Services. As a key implementing partner, the CDC works side by side with the Ministries of Health, civil and faith-based organizations, private sector organizations, and other on-the-ground partners to improve methods for finding, treating, and preventing HIV. The CDC received more than $5.4 billion for fiscal years 2019 through 2021 to accelerate HIV treatment and prevention worldwide by using public health, innovation, and data-driven approaches to achieve the global goal of HIV/AIDS epidemic control. Now, to date, HHS OIG has conducted 21 audits of recipients in 8 countries on 2 continents, Africa and Asia. OIG's PEPFAR oversight has helped grant recipients learn important grant and program integrity lessons that apply to ongoing and future responses to infectious diseases. In previous audits of foreign PEPFAR recipients, OIG identified unallowable expenditures, inadequate accounting systems, and internal control weaknesses. OIG will determine whether selected foreign or domestic recipients, number one, managed and expended PEPFAR funds in accordance with award requirements, and number two, if they had controls to mitigate potential risk to the PEPFAR program. This final report is expected in fiscal year 2023. Now, the fourth OIG Work Plan update for October 2022 is titled Implementing Average Sales Price Reporting Requirements for Skin Substitutes. This report is coming from the Office of Evaluation and Inspections. Before 2022, average sales price, or ASP, reporting requirements applied only to Part B drugs subject to Medicaid rebate agreements. However, manufacturers of skin substitutes used in the treatment of wounds generally did not participate in the Medicaid drug rebate program and thus were not required to report ASPs. Congress addressed this reporting gap through the Consolidated Appropriations Act of 2021 with an implementation date of January 1st, 2022. Preliminary analysis indicates that number one, several manufacturers of skin substitutes did not report ASPs as required, and number two, that CMS has not uniformly set payment amounts using ASPs for cases in which manufacturers reported such data. Given that Medicare Part B spends more than $1 billion per year on skin substitutes, this early alert will seek to quickly identify and address reporting and implementation issues. This final report is expected in fiscal year 2023. Now, the fifth OIG Work Plan update for October 2022 is titled Potentially Preventable Hospitalizations of Medicare-Eligible Skilled Nursing Facility Residents. This report is coming from the Office of Audit Services. Prior OIG work identified nursing facilities with high rates of Medicaid enrollee transfers to hospitals for a urinary tract infection, a UTI, which is a condition that is often preventable and treatable in the nursing facility setting without requiring hospitalization. The audits disclosed that the nursing facilities often did not provide UTI prevention and detection services in accordance with its residents' care plans, increasing the residents' risk for infection and hospitalization. Previous CMS studies found that 5 conditions, pneumonia, congestive heart failure, UTIs, dehydration, and chronic obstructive pulmonary disease and asthma, constituted 78% of the long-term care resident transfers to hospitals. Additionally, sepsis is often considered a preventable condition when the underlying cause of sepsis is preventable. OIG's review of claims shows that skilled nursing facilities, or SNFs, residents often present with one of these 6 conditions: pneumonia, congestive heart failure, UTIs, dehydration, chronic obstructive pulmonary disease or asthma, and sepsis on inpatient hospitalization. OIG will review inpatient hospitalizations on SNF residents with any of these 6 conditions and determine whether the SNF provided services to residents in accordance with their care plans and professional standards of practice. And this is in 42 CFR section 483.21 and 42 CFR section 483.25. This final report is expected in fiscal year 2024. And the final 6th OIG Work Plan update for October 2022 is titled OIG Oversight of Medicaid Fraud Control Units. This report is coming from the Office of Evaluation and Inspections. The 53 Medicaid Fraud Control Units, or MFUCUs, located in the 50 states, the District of Columbia, Puerto Rico, and the Virgin Islands investigate and prosecute Medicaid provider fraud, as well as complaints of abuse or neglect in healthcare facilities, board and care facilities, and of Medicaid beneficiaries in non institutional or other settings. OIG provides oversight for Mafukus and administers a federal grant award to fund a portion of each Mafuku's operational costs. OIG, in exercising oversight for Mafukus annually, recertifies each Mafuku and assesses each Mafuku's performance and compliance with federal requirements. OIG also provides technical assistance and training and identifies effective practices in Mafuku management and operations. They will perform on-site reviews of a sample of Mafukus. They will also issue an annual report that will analyze the statistical information that was reported by Mafukus, describing the aggregate outcomes of Mafuku criminal and civil cases. The report will also identify trends in Mafuku case results. This final report is expected in fiscal year 2023. And now it's time for my best practice tips in Trusty Tip. So, in today's compliance tip, I wanted to dive into the latest Comparative Billing Report, or CBR, that's been issued on initial nursing facility evaluation and management services. It is CBR number 202209. That's right, it's the 9th CBR issued for 2022. Now, right now, during the end of October, the beginning of November, CMS will be issuing a comparative billing report, that's CBR, on rendering providers that submitted Medicare Part B claims for initial nursing facility E&M visits they provided. Now, this CBR number 202209 focuses on the current procedural terminology. Those are our CPT codes, 99304, 99305, and 99306. Now, the CBR analysis was based on claims extracted from the Integrated Data Repository using the latest version of claims available on July 21st, 2022. Now, this analysis includes claims with dates of service from June 1st of 2021 through May 31st of 2022. The 2021 Medicare Fee-for-Service Supplemental Improper Payment Data Report reflects an improper payment rate of 14.1% for nursing home visits. Now, this improper payment rate reflects and represents $340 million and more in improper payments. Now, the types of errors that comprise this overall improper payment rate for Medicare Part B nursing home visits include 37.1% improper payment rate that's attributed to insufficient documentation, and 54.9% improper payment rate is attributed to incorrect coding. Now, after review of and their research into this improper payment rate, this CBR was created to analyze the possible threat to the Medicare Trust Fund associated with initial nursing facility E&M visits. So the expectation is that providers that provide these services will maintain proper documentation for patient care and confirm correct coding processes. Now, the criteria for receiving this CBR are that a provider is, number one, significantly found to be higher compared to either their peer group or national percentages in any of these three metric calculations, which means they're going to have to be greater than or equal to the 90th percentile. And then number two, this particular provider has had at least 40 total patients with claims submitted for initial nursing facility visits with CPT codes 99304, 99305, and 99306. And finally, third, this provider will receive this particular CBR if they've had at least $7,000 in total allowed charges. Now let's go back to those CPT codes I mentioned, right? 99304, 99305, and 99306. What do those mean, right? Why are they highlighting these? Let's go over some of those definitions to understand. So 99304 by CPT definition is initial nursing facility care per day for the evaluation and management of a patient, which requires these three key components. So you have to have these three things: a detailed or comprehensive history, a detailed or comprehensive examination, and a medical decision making that is straightforward or of low complexity. Now, usually the problems requiring admission are of low severity. Typically, 25 minutes are spent at the bedside and on the patient's facility floor or unit. So that's the definition of 99304. Let's move on to 99305. Now, CPT states that it is initial nursing facility care per day for the evaluation and management of a patient, which requires these three key components: a comprehensive history, a comprehensive examination, and a medical decision making of moderate complexity. And usually the problems requiring admission are of moderate severity. Typically, 35 minutes are spent at the bedside and on the patient's facility floor or unit. So that's the definition per CPT for 99305. Let's move on to that last CPT code that the CBR is addressing here, and that is CPT code 99306. So its definition is initial nursing facility care per day for the evaluation and management of a patient, which requires these three key components: a comprehensive history, a comprehensive examination, and medical decision making of high complexity. Usually, the problems requiring admission are of high severity. Typically, 45 minutes are spent at the bedside and on the patient's facility floor or unit. Now, for example, let's move on. Your CBR will identify in a chart or in a table what your utilization for a specific time frame is. Like, for example, your summary of your utilization of CPT codes for initial nursing facility E&M visits between June 1st, 2021 and May 31st, 2022 for CPT codes 99304, 99305, 99306 include details like this. For example, it can state that your allowed charges were $959 for 11 units of CPT code 99304 for a total of 10 of your patients. It could also say that your allowed charges were $21,000 for 174 units of CPT code 99305 for 154 of your patients. Or finally, it could say something like your allowed charges were $17,000 for 108 units of CPT code 99306 for 102 of your patients. And that's just for an example. Now, the metrics, they go on and outline in your CBR. They talk about this report is an analysis of the following metrics. They're going to look at number one. Metric number one is for the average weighted services billed per day. The second metric is for the percent of beneficiaries with more than one allowed service. And finally, the third metric that they're looking at is the percentage of total Medicare Part B allowed amounts submitted for initial nursing facility E&M visits. Now, the CBR analysis focuses again on providers listed as rendering providers on Medicare Part B claims for initial nursing facility E&M visits. Now, statistics were calculated for each provider, all providers in the state, and all providers in the nation. The state and national peer groups are defined as follows. The state peer group is defined as all rendering Medicare providers practicing in the individual provider's state or territory with allowed charges for the procedure codes included in this study. And of course, the national peer group is defined as all rendering Medicare providers in the nation with allowed charges for the procedure codes included in this study. Now, each provider's values are compared to his or her state peer group values and to the national values. So they're comparing your metrics to your state as well as the nation. So there are 4 possible outcomes for the comparisons between the provider and his or her peer groups. So number 1, you're going to be called out significantly higher, which means that you are a provider whose value is greater than or equal to the 90th percentile from the state or the national mean. Or number 2, you've been designated as higher, which means that you're a provider whose value is greater than the state or the national mean. And then third, they will identify you as does not exceed, which means that your provider's value is less than or equal to the state or the national mean. And finally, fourth, they will call you out as not applicable, which means that you're a provider that does not have sufficient data for comparison. Now, of note here, there are 39,212 providers specifically nationwide that are listed as rendering providers on claims for initial nursing facility E&M visits. Now, the total allowed charges for these claims were over $334 million during this analysis timeframe. Now, remember that the initial nursing facility E&M visit clearly is vulnerable, right? These visits pose a risk to the Medicare Trust Fund. Now, according to the 2021 Medicare Fee-for-Service Supplemental Improper Payment Data Report, remember that the improper payment rate of 14.1% for nursing home visits represents over $341 million in improper payments. And let's break that down even further, right? Specifically to all of us in this little niche. 37.1% of this improper payment rate is due to insufficient documentation. And then there's a whopping 54.9% of this improper payment rate is due to incorrect coding. Now, the desired behavior here for initial nursing facility E&M services, again, is to protect the Medicare Trust Fund, right? And it's also to increase providers' awareness about the utilization of initial nursing facility visits. It's also to support providers' internal compliance processes. And it's also to provide coding guidelines and coding requirements. So it's critical to understand that a CBR does not indicate that you are going to get an official audit. Although, like I've said on all of my previous CBR segments on my podcast, be mindful that this phrase is directly coming from the MACs that issue the CBRs. So take that with plenty of grains of salt. More directly, consider this to be your notice, your warning that yes, you are being looked at closely. But the value of the CBR to providers is that it absolutely 100% does serve as a tool for you, a tool to look at your billing patterns compared to your peers in your state as well as across the nation. The value also most certainly includes the facts that specific coding guidelines and billing information will be detailed, as I gave to you earlier. Now, this particular CBR informs providers whose billing patterns differ from those of their peers. So your letter will definitely give you the metrics that they've identified. Now, the desired behavior here, right, is absolutely to capture proper and compliant documentation for these types of initial nursing facility E&M services, right? Absolutely. Because these numbers are way too high of an error rate, in my opinion, right? Let's not forget 37.1% is due to insufficient documentation and 54.9% is due to incorrect coding. So my best practice recommendations always include to please review your CPT codes to ensure correct code assignment. You should be performing regular internal reviews of the documentation and of the code selection to ensure accuracy and compliance. These two steps alone, in my opinion, can help reduce the possibility of improper payments down the road. Now, while insufficient documentation and incorrect coding are both killers here in this case, right? So it's really about meeting those CPT code definitions, right? So let's remember that those three key components are a must for all three of our CPT codes highlighted for this particular CBR for initial nursing facility care E&M visits per day, right? That 99304 has to require those three key components of a detailed or comprehensive history, a detailed or comprehensive exam, and the MDM has to be straightforward or low. So those three components have to be met for you to be coding and then billing on a claim 99304. Same thing goes for the next level of code, 99305. It also states that all three key components must be met for you to be able to code and then bill for 99305, right? So you must have a comprehensive history, number one. You must have a comprehensive exam, number two. And finally, your third MDM has to be of a moderate complexity to be able to code and then bill for CPT code 99305. And then finally, that third CPT code 99306, you must meet the requirements for those three key components as well. You have to have that comprehensive history, you have to have that comprehensive exam, and then that MDM has to be of a high complexity, right? So all three of those elements have to be met for you to be able to compliantly code and bill for CPT code 99306. So this particular CBR should have all of us performing initial nursing facility E&M visits really buckle down and self-audit whether we did receive this CBR in the mail or not. It's a really good time to dive deeper into your own data, help yourself, and help the Medicare Trust Fund at the same time. You should be paying attention to what you are sending out the door. Is it really in compliance? So stay ahead of the curve and avoid receiving post-payment audits from the payers down the road. It's fundamental if you have Medicare as a payer to keep your eye on correct and compliant coding and billing practices and make sure that you are adhering to all of them. It's so important to make sure your clinical documentation addresses and captures all indications for coverage and medical necessity, and you avoid the whopping 37.1% of improper payment rate due to insufficient documentation, as well as the whopping 54.9% that's due to incorrect coding. So, a better and smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, I focus Season 7 Spark on purpose and impact. I want this 7th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for purpose and impact in all we strive to do. So, in this week's inspiring quote in Spark is from Bishop T.D. Jakes. If you can't figure out your purpose, figure out your passion, for your passion will lead you right into your purpose. Absolutely true, right? I think this is an amazing quote that reminds us to look closely at our passions. I think this quote reminds us that we all have things that light a spark within us. This quote inspires us to look with intensity at those passions. I think this quote reminds us that we should not dismiss our passions as frivolous or flighty. I think this quote reminds us that our passions reflect our integrity, our character, our beliefs. I think this quote inspires all of us to use our passions to drive our greater purpose. I think this quote enables us to leave our own legacy of impact kind. I'm happy Bishop T.D. Jakes' spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, let's not forget, big shout out to my very good friend, Kimberly Jolivet Williams. She's been my guest here several times and serves, again, as one of the best educators that I know. And she is hosting a Business of Healthcare Colloquium that takes place virtually this very weekend on November 12th through the 13th. Now, I'm going to be speaking at this Business of Healthcare Colloquium, as well as numerous industry leaders that I've had the pleasure of hosting on my podcast as well. Terry Fletcher will be there, Rosemeen Bapat will be there, Jennifer McNamara, Betty Hovey, Christine Hall, and so many other professionals as well. It's going to be an amazing event. You get to pick up so many CEUs at such a reasonable cost. So I really hope many of you have signed up already. You still have time to sign up to join us on November 12th and 13th. Now, in my last thoughts today, remember, we only have this one life to live, right? In this one body, life is incredibly short, so make the most of each and every day. Keep carving out time for yourselves as well, right? To not only prevent full-blown stress and burnout, but to heal from it as well. And of course, please continue staying safe and healthy. We're still in a PHE status, and it is the beginning of flu season. The flu is definitely increasing its intensity down south and will surely make its way up north very soon as well. Now, thank you guys so much for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.